In 1958, a nuclear accident exposed several Yugoslavian physicists to a massive dose of radiation. At the time, this was an absolute death sentence. Dr. Georges Mate attempted a rescue using an experimental method, infusing the poisoned physicists with donor bone marrow. In earlier studies, Mate had identified a lethal complication called graft versus host disease. He found that unless the recipient's immune system was completely neutralized, the donor marrow would recognize the patient's own cells and launch a fatal attack against them. Mate used the radiation that had poisoned these men to his advantage. Because the radiation had already neutralized their immune systems, the donor cells were able to survive and replicate without conflict. He saved all but one of the physicists. For most of human history, nature dictated our mortality. Surviving a fatal illness or a catastrophic injury required constant, deliberate defiance against invisible biological forces. The modern medical safety net isn't a natural given. It is a hard-won construct engineered by a handful of revolutionary minds. In the 18th century, smallpox was responsible for the deaths of 20% of the population. This medical illustration of variole confluente shows the severe physical toll of the disease. Dr. Edward Jenner introduced the world's first vaccine to counter this threat, a foundational act of immunology that led to the WHO declaring smallpox eradicated in 1979. In 1928, Captain Alexander Fleming was studying the influenza virus, focusing on how certain substances could naturally destroy bacteria. While examining a Staphylococcus culture, he found that a stray mold had developed on the plate. This mold created a bacteria-free circle around itself, effectively preventing the staphylococci from advancing. This accidental discovery of penicillin proved that even lethal bacterial infections could be halted by the right chemical agent. By exposing the mechanics of the microscopic world, these doctors turned invisible enemies into visible, curable targets. Not every threat is microscopic. For centuries, the human heart was considered an untouchable domain, where physical damage was almost always fatal. Dr. Daniel Hale Williams challenged this by performing the first successful open-heart surgery in the United States to repair a physical wound to the pericardium. Dr. Helen Brooke Tauzik applied a similar mechanical approach to pediatric cardiology. She developed the shunt procedure to correct fatal physical flaws in children born with tetralogy of Fallot. Tauzik also lobbied for the ban of thalidomide, a drug that caused severe infant deformities when taken during pregnancy. Dr. Michael DeBakey spent over 7 decades refining these mechanical interventions, performing surgery on over 60,000 patients. DeBakey treated the vascular system like a machine. He utilized plastic tubing to restore circulation to limbs and installed the first artificial pump to assist a damaged heart. These pioneers proved the body is a mechanism that can be physically repaired, upgraded, and restored. A surgical technique or a chemical cure is only effective if the medical system can actually deliver it to the patient. To make transfusions viable on a massive scale, Dr. Charles Richard Drew redesigned blood storage. He developed mobile blood mobiles and the improved storage techniques that formed the basis for the American Red Cross Blood Bank. In maternity wards, Dr. Virginia Apgar introduced the Apgar score. Her system forced hospitals to use standardized measurements like heart rate and respiratory effort to ensure a newborn's survival. Survival was also limited by who was allowed into the room. Elizabeth Blackwell faced severe discrimination before becoming the first female physician in the United States, eventually founding her own infirmary to treat indigent women. Dr. Daniel Hale Williams took this a step further by founding the first non-segregated hospital and nursing school for African Americans in the U.S. These doctors proved that survival is as much about the delivery system as it is about the medicine. They expanded the reach of healthcare by removing the logistical and societal barriers that kept life-saving care from the patients who needed it most. Today, the effort to control biological threats continues on a global scale. Dr. Helene Gale's work as an epidemic intelligence officer has been central to the study and prevention of HIV/AIDS and tuberculosis worldwide. Every vaccine, transfusion, and surgical procedure we rely on today exists because these 10 visionaries refused to accept death as a certainty. The preservation of health drives economic growth and the overall quality of life, and the system relies on new researchers continuing the work. The blueprint of modern survival is a map drawn by these 10 visionaries. The next medical revolution will be written by those who continue to research, innovate, and refuse to accept current limits as the final word.